Also today here are Rishi Sood, Executive Director of Care Access and Policy in the System. And Svetlana Brodeniuk, Assistant to the Secretary to the Department. The purpose of today's hearing is to elicit comments and information to assist the Commissioner in determining whether to add a new Chapter 38 program to cancel medical debt to Title 24 of the Rules of the City of New York, the Commissioner's regulation governing program to cancel medical debt. A notice of intention to add this Chapter 38 was published in the City Record on Friday, February 16, 2024. Copy of the first page of the notices of intention will be provided to the court reporter to include in the record. Persons wishing to speak at this hearing were asked to pre-register and they will have a limit of 3 minutes to speak. We have one person registered to speak today. That person does not appear to be present at this time.
No, Miss Tracy is here.
Oh, okay. Ms. Tracy, please introduce yourself.
I'm Senior Director of Health Initiatives.
Yes, you can speak.
You can go forward with your comments now.
Thank you. I'm so sorry. I was muted. Hi, I'm Carrie Tracy. I'm Senior Director of Health Initiatives at the Community Service Society of New York. And so I'd like to thank the department for giving me this opportunity to comment. CSS is a 175-year-old nonprofit dedicated to fighting poverty and improving the lives of New Yorkers. And we have a number of health programs that help folks use insurance, get insurance, or find ways to access care if they can't get insurance through a live answer helpline and a network of over 50 community-based organizations around the state. And we help over 130,000 people a year and save them $80 million. And it's from that experience that we're commenting on these proposed rules. The Urban Institute found that over 740,000 New Yorkers have medical debt, and that in every region of the state, it's disproportionately concentrated in communities of color and low-income communities. So with that in mind, we have some recommendations for ways to make these rules stronger. And the first is we recommend that the city require the contractor to focus first on lowest income folks before helping higher income folks, because that burden of debt is much higher on lower income folks. And a related sort of portion to that is that the rules say that the contractor will help folks with incomes below 400% of poverty, but New York State law, the Hospital Financial Assistance Law, requires that every hospital provide financial assistance to folks who are uninsured whose incomes are below 300% of poverty. And many hospitals in the city say that they also offer financial assistance to folks who are insured or whose incomes go up to 400, 500, 600%. So before this funding be used to forgive a debt for someone at those lower incomes, the hospital should first attest that they've screened the person for financial assistance and applied the maximum benefit that the person is eligible for. So this funding isn't used to buy debt that should have already been wiped off. We also recommend that the city define other healthcare providers. It's not clear what that means. Folks who have hospital debt, 73% of folks with medical debt owe part or all of that debt to hospitals. So that really is a high priority. Hospital debt should come first. And we also suggest that next should come ambulance debt. We see that the debt to the fire department of New York for ambulance rides is not included in this, but we find that's one of the most burdensome things for New Yorkers. There isn't a surprise billing protection for ambulance rides, and it's incredibly expensive, and folks are really finding that burdensome. We suggest removing that part of the rule. And the third thing we recommend is that the city require the contractor to report on how they spent this money. $18 million is a huge amount of money. It could do a lot for folks with medical debt. And so we suggest that the city should require the contractor to report who received this relief, their income, any other demographic information, which hospitals received the funding, and so that the city can say, this is how the money was spent and here's who it benefited. And also, finally, if there's a way to prioritize funding folks who their medical debt is being held by a safety net hospital, that really serves a disproportionate share of folks who are uninsured and have Medicaid, rather than hospitals that are very, very wealthy in New York City and serve a lower percentage of folks with a medical debt who are uninsured and have Medicaid, and sort of split that burden a little bit. And I have more complete recommendations in the testimony that I'll submit later. But that was sort of the briefest I could make it.
Thank you for those comments. It appears that we do not have any additional attendees wishing to comment. If anyone joins now and wishes to testify, they can indicate so in the chat area. Seeing as we have no additional attendees who wish to speak at this time, we will adjourn the meeting until 11 a.m. or until we receive notification that additional attendees wish to speak. As I initially noted that Rishi Sood was in attendance, that was a mistake. In fact, Allison Jensen, Senior Manager of Community Partnerships and Equitable Health Systems at DOHMH in Healthcare Access and Policy, is attending. As there are no other attendees, we will again adjourn until anyone joins and indicates that they would like to comment, or until shortly before noon. The time is now 11:58 a.m. As we have no attendees at this time and no additional members of the public have indicated that they wish to comment, the meeting is